Good morning, everyone, and welcome. Thank you so much for joining us today for Southern California Grantmakers Funders discussion on COVID-19, focusing on mental health, trauma, and recovery. My name is Cameron Green, and I am the Director of Professional Learning and Communities here at SCG. And our mission at this specific moment is to mobilize philanthropy to respond rapidly, effectively, and equitably to the COVID-19 pandemic. And we're doing this by fostering inclusive collaboration, learning, and bold actions. It is for those reasons that we've started these weekly funder discussions. And so we really, truly thank you for joining us today. Now, before we dive in, I want to share a really high-level overview of the work that SCG is doing beyond the webinars to support our members in response to these efforts. We're closely working with our partners at Northern California Grantmakers and San Diego Grantmakers under the umbrella of Philanthropy California. And we've assembled a comprehensive microsite of resources, which you can find via SCG's website. Resources include vetted funds at the local, state, and national levels, and an option to search and filter through these dozens of funds depending on your mission or geographic focus. There's a public policy page to help you sort through and understand the many legislative and government responses as well. Our teams also stand at the ready to help answer your questions, track down additional resources, and of course, anything you might need in this critical moment, we are here for you. We plan to host these calls weekly through the end of this month, and then we'll transition to a bi-monthly schedule, and then every other week in May, and starting in May. So we hope that this can be your high-level entry point to important issues that you need to be aware of and work that's happening by your peers. And then after and in between these calls, we're going to be offering lots of deeper dive conversations and programming. So now we'll transition to the heart of today's call. And as I mentioned, the purpose of these discussions is to create a platform through which to share how funders in Southern California specifically are responding, to identify unmet needs, to help connect you all with one another, and to enhance strategic and aligned funding and identify where SCG can support work. To that end, the format of today's call is going to be 3 case studies from different organizations who are engaged in response efforts specifically as related to mental health, trauma, and recovery. Each speaker will share about their work for approximately 7 to 10 minutes, and then we'll transition to Q&A. You can submit your questions at any time through our GoToWebinar chat box. It should be on the side of your screen. And we will try to get through as many questions as possible at the end. After today's call, you will receive a very short survey where you can give us input on how we can best support you in these calls going forward. So please do take a moment after today to provide that input. Because we have over 100 people on the line and all attendees are on mute, as I mentioned, please utilize the question box for questions and also share any of your own resources that you want to make sure the group is aware of. All right, with that, I want to turn it over to our exciting panel of speakers today who are working across the entire Southern California region. Join me in welcoming Dr. Jonathan Sharon, who is the Director of Mental Health of Los Angeles County, Kirsty Thompson, the Director of Give an Hour, and Mercedes Perez-Chica, who is the Director of Community Giving at SCAN Health Plan, Independence at Home, which is a SCAN community service. Unfortunately, Dr. Nagel, who is from Orange County, is unable to join us today and this morning, but we do hope to have him in the future. So Dr. Sharon is joining us by phone this morning. He can only stay on the line until 9:30, so we want to make sure we start off with him, and we want to hear from him and then take a few questions from the audience before moving on to our 2 other speakers. So good morning, Dr. Sharon. Thank you so much for joining us today. We'd love to start by hearing how LA County's Department of Mental Health is responding right now and where you're seeing some of the biggest gaps and challenges. Welcome, Dr. Sharon.
Thanks very much, and it's always an honor. I will say that this and many, many other kind of town hall type engagements for me are difficult because I love being with people and I love feeding off the energy of people. And this is an incredible group. I will say that at 9:30, I have to actually move to testify in person to Judge Dave Carter about homelessness and veterans. And one of the great partnerships between the Department of Mental Health and Southern California Grantmakers is around a shared initiative, the Veteran Peer Access Network. And you can bet that that'll be a topic of great interest in that testimony. So thank you very much. What I'll say in general is that this has obviously been a massive pivot for us. I mean, it's a massive pivot for every person really on the globe in general, but certainly in the Department of Mental Health, a massive pivot. And what I see happening in a lot of areas, I believe will over time translate into some silver linings. A lot of the things that we're doing now at breakneck speed are things that I've wanted to do to be a responsive department. And I think that I try to be an aspirational and optimistic guy, but I think COVID is really going to help us achieve a new level of function. Examples of pivots. We now have 90% of our staff, which is somewhere on the order of 5,000 to 6,000 people, teleworking. 90% of them are now actually working from home. And I think you can imagine what kind of a change that is in terms of how we're getting our work done. In terms of disaster service workers, as government employees, we as the department have over 300 people that are deployed around the county and in many ways supporting the shelter work for the homeless, which is a big deal. And I would say pound for pound, I think this department is probably doing as much or more than any other department in terms of that redeployment. In terms of our straight up clinical services, we have pivoted our clinical interface to telehealth. And the thing about the telehealth move for me that's so exciting is that we're actually having more encounters than we did before. We're up to about 105% of our prior capacity, and roughly 80% of our encounters are through technology. Big deal for us. Well, huge challenges that we face, and all of us are anxiously awaiting CARES Act 4 from the federal government, is how to claim. We're doing things differently, and we're set up as a fee-for-service network, so we have to claim. And it's difficult to claim funds when you're doing work in a way that's not recognized. And it's one of the things that I would suggest we, as a department and across the state, could use to leverage the concept of a per member per month payment, which I've been advocating for a long time. In that scenario, it's not about fee-for-service. It's about give us the money to take care of the people, and we will take care of them properly, and we'll get better outcomes. On that note, I will say that we as a department depend upon an incredible network of providers. About half of our work is managed by community-based organizations. And those organizations face the same issue with funding and with the ability to support the work. And we have provided a significant change in the way that we're funding them and giving them money up front as an advance to keep that network alive. One of the big deals here is the fact that we're a specialty mental health department. We have a responsibility for probably about 500,000 people in Los Angeles County if we were to get to everyone with a serious mental illness. And in the context of a disaster, we become responsible for 10+ million. Everyone in LA County becomes someone that we need to attend to in the context of trauma and disaster. That's a big deal for us. It obviously requires a pivot in our work. It also requires us to get access to additional funding. It's not clear from the Fed and the state that whether we're going to get adequately reimbursed. I want to go around the horn and just talk a little bit about the work. And I'm sorry if I can't do this in 10 minutes. I'm going to do my best. First, what I'll say is that we are doing disaster communications in a really robust way. We're pushing out through town halls. We're pushing out through radio, through billboard around COVID with a primary message of we need to stay together, that it is in unity that we will defeat this virus and we've bent the curve around a lot of that messaging. It's very important. We've also created a speakers bureau across different languages so that we make sure we're translating folks in a really robust way. We're also driving a lot of traffic through our messaging to a new warm line, which is really a second initiative. We have taken our hotline and created a warm line that added a warm line so that we're not just dealing with acute clinical issues, but we're providing emotional support broadly to the County of Los Angeles. We also have a dedicated line with expertise around moral injury focused on county staff and those staff who are frontline, particularly healthcare workers. Going from there, we're in the process of addressing the surge. As you all have heard, we need to make sure our hospitals are equipped to provide ICU care. So we're cascading people out of the hospitals into subacute care, into open residential care, and into community-based services and living environments, and that's going incredibly well. We have increased our discharges from the Department of Health hospitals probably fivefold, and that's going to continue over the coming weeks to make sure that the hospital has as much of its resource available to provide life-saving measures during this time when a surge becomes more and more likely. We're also doing what we call crisis in place. So rather than having crisis in the community and in the streets and using emergency rooms and hospitals, we're actually going above and beyond to keep people in the community when they're in crisis. That's a practice that I want to see continue to grow. We're also doing massive efforts general for those who are vulnerable and that we care for to keep them in the community, not just through maintaining our clinical services, but for making sure that we have in-person interventions when they're needed. One example would be IM medications and not just relying upon telework. We're also, to fill up the shelters that we're trying to expand that I'm sure you've been hearing about, we have expanded and continued our street outreach work, making sure that those vulnerable populations that need us continue to have us. The other thing that we're doing is we're looking to bring together all of our prevention books of business, and I'm going to finish with that and what that means to us going forward. In addition to those books of business, those initiatives that I just described, we're also aggressively going after funding, which I had talked to you about. We are really showcasing technology supports, not just around telehealth, but around collecting new data and around creating dashboards to demonstrate the impact of what we're doing, not just the processes that we're expanding, but the impacts that we're getting and also the fiscal implications. And then, of course, we're putting a great effort into the well-being and the safety of our staff, and not just our staff, but those staff that serve through the community-based organizations. Examples of that are going after PPE aggressively, making sure that it's equitably distributed, making sure that it's being used according to guidelines from CDC and the Fed all the way down to the state and local health orders. In addition, as you can imagine, there's a lot of effort that's required for us to make sure that the flow of work in our clinics is being done properly with respect to physical distancing, and that we're really getting the people who are working from home activated. The big deal here for me is to talk about the movement from what we call community access platforms to a county access platform. And I had talked about the prevention work, and what I'm going to say is that while we're in a response mode now, we're going to be moving towards a recovery mode. Recovery mode is relevant for our core customers. It's core for anybody that has mental issues. It's core for everybody in this county. There's not a person that's not being touched by this in some way. And we could say, as Governor Cuomo says, that really this is a mass post-traumatic stress experience. And the financial aspects and the change in routine and the change in reliance upon behaviors that keep us going is pretty dramatic. And we, as a county, have the opportunity as well as the challenge to put together collective action. And being aspirational, I see what we can do now, silver lining style, as a county, as a stepping stone to what we want to achieve in 2028 with the Olympics. So what I'll say on that note is that we are looking at our We Rise campaign, and I think many of you are aware of the We Rise campaign. I sure hope so. And if not, please look online as a way to kind of be a megaphone for this county, for cohesion, for capacity building. for interconnected activities that we require to deal with all of our shortcomings and really addressing our social ills in a broad way. We look at the opportunity through Southern California grant makers to create a public-private partnership that really will have to become elevated in a new way for collective action. Because in the Department of Mental Health, what we say is none of us is well until all of us is well. And one of the things I will say about this effort is that an individual very well known to Southern California grant makers, Gita Cugley, in her capacity as a consultant, is going to be helping lead this work and coordinate a lot of the efforts across sectors, and we're very excited about that. One of the things that it's interesting because I really didn't know, I didn't know that Givenhour was on this call. And one of my great colleagues who I worked with during the Obama administration on developing a campaign to deal with community violence was Barbara Van Dalen, who started Givenhour a long period of time. And one of my asks, which I've already discussed with Kate Anderson, is that we figure out how to activate volunteer efforts amongst the mental health community. So the private mental health specialists and professionals, we're going to look to them to help step up. When this department takes on the anxiety, the fear, the depression of 10 million people, we require collective action. We need platforms that will activate very specifically that group of people so that we have a back end when we identify people who are sick and when they exhaust our ability to provide that treatment. So I'm thrilled that there's this kind of convergence of efforts on this call. I could talk to you for a very long time about everything that's going on. This is a very high level brief. I'd like to come back to you more specifically, but I'm just going to throw it out there as my intro, and I'm more than happy to field any questions.
Thank you so much, Dr. Sharon. Yes, we could, you're right. This is such a robust and important conversation. We could definitely continue, and we hope to do that at a future time. We do want to, before you have to leave us, just capture a few questions that, if you wouldn't mind just speaking briefly to. Would you mind commenting a little bit on the impact of this pandemic, specifically on young children ages 0 to 5? What are the needs specific to that population and how we can best support them?
Well, I mean, when we have trauma and fear ramifying through every demographic, every socioeconomic status, every household is impacted. There's not a child that's between the ages of 1 to 3 that's not feeling this. They may not be cognizant, although they, I believe, are quite more conscious than we would estimate. And our home visiting efforts continue. And I think one of the things that we actually achieved as a collective with help from the private sector, and by recovering money from the state that many of you would recall was supposed to revert when I showed up, we have invested in home visiting, dramatically increased our capacity, created through that priming of the pump, ongoing resource stream so that we can sustain those efforts. And we think that those efforts are as important now as ever because there's trauma in the little brains across this county. And we, with the Department of Mental Health and many, many great community organizations, are going to continue to do that work. And I'd see that as an area of expansion.
Great, thank you so much. The next question is, can funders and other advocates, funders and others, advocate for the change in how county reclaims funds? How will we do this? Will we do it through Congress? Your thoughts on that?
Oh boy. Well, yes, this is like advocacy 101. And this is an absolute must. I mean, I have been pushing for payment reform so that we as a county and our front lines are empowered to do the work so that we're not constantly being dragged down and really kind of exhausted by bureaucracy and administrative activity. I would say that at least half of the effort in our trenches is spent on documentation and taking care of auditors when we need to be taking care of people. I will say that the new administration, the Newsom administration, has done a fair amount to look at simplifying our processes in the trench, but they did not go for fundamental reform around moving from a fee-for-service reimbursement strategy to one where we get money up front that we can spend to take care of people. And I would suggest that Southern California grant makers work side by side with us, with our provider network, with county departments across the state to make this message super clear to the state administration and also to the Fed. Because I can assure you that my department, my staff, all of our contractors would be much, much more effective right now if we had a per member per month or some other type of funding mechanism as opposed to a fee-for-service mechanism.
Great, thank you so much. And then how can the arts and the arts organizations support the work of DMH in expanding better health outcomes for residents of Los Angeles?
It's a great question, and I mean, I come back to We Rise as a movement. We Rise as a megaphone, and by a megaphone, I don't just mean with voice. I mean with every medium, including the arts. We look to the art world to help heal through people being able to express themselves, heal by people being able to be productive and have meaning and purpose in their life. Art to help provide the narrative across our different communities as to what mental illness is, what mental health is, what well-being means, and how we as a collective are interconnected, and that we must participate together. And, you know, arts, and I don't just mean painting and drawing, we're talking about photography, we're talking about performance art, we're talking about music, we're talking about anything in the arts, is a critical part of our work, and it needs to be showcased at a level we haven't seen as we move into We Rise 3.0. And those opportunities will be made available to the community and to all art organizations.
Thank you so much. We have just another minute, and someone did have a question about an example of crisis in place. Can you elaborate just briefly on a concrete example of what you meant by crisis in place?
Well, crisis in place, this is an example of something I've wanted to do for a long time. We have people who, let's say, are in a community, they may be in a household, or they may be in the street, who are having crisis, whose behavior is deteriorating rapidly, and they may pose a direct or indirect threat to themselves or to the community. The Department of Mental Health is oftentimes called in. Oftentimes we're called in partnership with law enforcement. And we kind of make a black or white decision in a gray zone. So it's kind of like, oh, well, let's bring this person in. Let's bring them to an emergency department because we're not really sure where it's going to go. Or, oh, well, let's just leave them and hope that nothing bad happens. What I've been arguing for, and we now have a new grant that will start July 1st to support this work, is that we need to not just engage with that person, we need to engage with them the next day and over the course of days, to look longitudinally at how they're doing, to intervene longitudinally to make sure that they're improving and doing it in the community rather than having to require an emergency department stay or a hospital stay. Right now, that's glaring because we don't have emergency department resource or inpatient resource because we need it to save lives through ICU care. So we are keeping people in the community. Of course, we're bringing them to urgent care centers and emergency departments when we need to. But what we're finding, and we're using not just in person, but also telepsychiatry in particular, is that we're able to significantly impact the number of people that have to get pulled out of community into expensive facility-based care. And by the way, facility-based care is in many times counter-therapeutic because it's a traumatizing experience for people when in fact, if we can deal with their crisis in place, in community, we're saving money, we're more efficient, people are not traumatized, and we're really achieving our fundamental theme, our fundamental goal, which is to keep people in community and giving them opportunities to flourish.
And in our final moment that we have you, Dr. Sharon, I'm just going to sneak in one last question in this last minute, and that is, given all the innovation in how and where services are delivered, what is the plan to continue telehealth and service at the site to avoid ER trips once the stay-at-home order is lifted?
Well, you know, those who have been working with me in this department know that I have been begging, pleading to expand our telehealth services. And now we have evidence to suggest that it's actually in many cases more efficient. So you can bet that we're going to keep the telehealth services alive. We're going to find out where they were impactful. We're going to find out where they were appropriate, and we're going to continue them, and we're going to expand them as indicated to be a more efficient department, but also to expand access. And I would say the same thing around telehealth. You know, forever, I'm trying to expand this department's footprint. And by that, I mean our impact on the community. And every time we try to put together a new program, it's like, oh, Dr. Sharon, you don't have space. You need to get another lease. You need to buy another building. And I'm saying, why? There's two things. Expand your hours and get people to work from home. We don't need as much square footage of building as we have now. And I would like to say that as we expand telehealth, as we expand telework, we're going to gain these silver lining added value moves going forward. And I'm not letting go of them. I'm not going to let go of them.
We appreciate you so much, Dr. Sharon. Thank you again for your time and your insights. We know you have to run now, so we greatly appreciate you joining us again. Thank you so much.
Thank you. Take care, everyone. Be safe.
So next, we're going to transition to hear from a direct service provider, Kirsty Thompson. She's the director at Give an Hour. And Kirsty, I know you're on the line, so thank you so much for joining us today. Can you just share with us an overview of what your organization does and how you're responding specifically to COVID-19? Welcome, Kirsty.
Great. Thank you. Can you hear me okay?
Yes. Thank you.
Wonderful. So thank you all for having me. My name is Kirsty Thompson. I'm the director of Give an Hour here in California. A lot of people don't know about Give an Hour, but we are a national nonprofit organization that was founded in 2005 by Barbara Van Dalen, who you heard mentioned a few minutes ago. And we got boots on the ground here in California in 2017. And here in Southern California, we do a lot of work around emotional wellness, education, support, and a lot of work in recovery, the borderline shooting, the fires. But I also heard the word a few minutes ago, pivot, and we have certainly had to pivot over the last month and a half to respond to this COVID-19 pandemic. And we're doing that in a few different ways here in Southern California. The first thing that we did was with some initial seed funding with the Ventura County Community Foundation. We established kind of one of those soft support lines here in Ventura County where folks can call in 6 days a week to check in, get tips on emotional wellness and support. That's available in both English and Spanish. And we would really love to expand access to that. I would love to offer that up to first responders, to people that are working in frontline jobs, and just expand that work. And then we're also offering a web-based kind of webinar training experience that really talks about coping with COVID from an emotional wellness perspective. And you can see on the slides there, if you want to go ahead and click through to the last slide, slide 5. This is kind of what the webinar or the training really encompasses, is how do we take care of ourselves? How do we take care of others through this pandemic? So also in Southern California, we've got about 300 licensed clinicians who are part of our volunteer network. So these clinicians they have clear licenses to provide pro bono mental health services to people that do not have access to mental health care. Our providers are rapidly adapting to the telehealth model out of necessity, and I have to say I've been very impressed with the way our providers are using telehealth. Many of them are actually now really preferring that mode because they can serve more people from the comfort of their home. And another goal that we have would be to get our volunteer network open, throughout Southern California to those being affected by the COVID pandemic. Unfortunately, we don't have the capacity to do that right now. We need, support to facilitate that. We need capacity with our national team to help with that. But that would be another goal of ours, would be to get that network open, those 300 providers who can serve from home via web-based platform to serve those who need individualized help in coping with this. So those are the three things that we're doing. We have started that model in the Connecticut, New Jersey, and New York area with some support through Aetna. So we are opening up that provider network to serve, first responders and frontline staff. But I would love to emulate that, in Southern California as well. So that is what we're looking at. And we're really, I would say the traction that we're seeing is, I had a call yesterday with Global Giving, who support some of our work. And, these are people that are in, they're in the grant making field, and, their team themselves is really feeling the effects of this. And I said, let's hop on a webinar. Let's go through this coping through COVID, curriculum. Gives people a chance to connect with one another, to check in, to see how we're all kind of struggling in the same areas, and remind folks that, we've got to put our own oxygen masks on first before we try and help everyone else. And everyone is struggling with that right now. So really normalizing how this is a challenge, and really taking care of ourselves in order to help others. So those are kind of the three things that we're doing: the warm line support, this coping with COVID webinar and check-in series, and then also, standing up our network to expand services to additional populations. Those are our kind of three goals and what we're working towards.
Thank you so much, Kirsty. We really appreciate you sharing that valuable information with us. And last but certainly not least, I'm going to transition to Mercedes Berechica. Mercedes is the Director of Community Giving at Scan Health Plan, and we'll take both questions from both for both Kirsty and Mercedes after Mercedes has had a chance to go through her presentation and make comments. So Mercedes, thank you for joining us today. If you could share with us how you all are thinking about and responding to mental health needs, especially for aging populations in response to COVID-19.
Great. Well, thank you so much for having me speak on the mental health needs of older adults and their family caregivers. Just a little bit of background in terms of what Scan Health Plan is and what we do. Scan Health Plan is a nonprofit Medicare Advantage plan with a dedicated charitable giving arm. We also do provide direct services through the Independence at Home community services. So we do see older adults and their caregivers and are providing some support during this difficult time. The target population of our giving and our programs are adults ages 55 years and older and their caregivers. Our programs and giving has really continued around social determinants of health, such as nutrition, transportation, and social isolation. So given the COVID outbreak, SCAN's community giving has shifted to emergency funding. And we're really focusing and prioritizing funding of nutrition and social service programs, 11 counties across the state. So I want to share with you a little bit about one of our first grants. So there, we funded the Institute on Aging, their 24-hour toll-free friendship line, dedicated to serving adults who may be feeling anxious, fearful, or lonely. The phone line is staffed with specialists who provide emotional support, grief support, active suicide intervention, information, and referrals. So in early March, with the threat of COVID-19, many older adults began isolating in their homes as part of staying at home orders that were rolled out. So regular sites such as their adult day healthcare centers, senior centers, churches, religious centers, congregate meals, they were all closing. Senior housing building also began to limit or deny entry to visitors, including families, friends, caseworkers, and service providers. So you could see the sense of feeling very isolated and fearful. The call volume to the friendship line increased dramatically, and staff needed to establish another call center to just help with the number of incoming calls, and they were tremendous. So we funded them to help with the staffing and infrastructure to help set another call center site. So what we were hearing, or what they were hearing, is really callers were lonely, depressed, isolated, fearful, and some were suicidal. Callers expressed fear of just waiting at home for them to eventually get sick and pass away, as they're at the most high-risk population of this pandemic. They also felt undervalued by society. And this is important to note and highlight. Not only did we see racism come up, but also ageism being expressed in media and society. The sentiments that old people are dying, so don't need to treat the pandemic seriously, have been in social media, which have affected older adults at this time. Also seeing discriminatory policies in California and several states against older adults in prioritizing and the provision of ICU ventilators and the life-saving treatments. As you can imagine, this takes a toll on an individual. Age has been included in determining a factor if there are shortages in the healthcare system. So it's not surprising that we are seeing the high levels of stress, anxiety, and depression among older adults and those medically vulnerable. So in the past 6 weeks, SCAN has awarded 24 grants to 24 agencies across 11 counties. And so what we have really focused is on funding food banks and agencies that are providing home delivered meals and groceries and other household items. These agencies are also making friendly calls, check-in calls over the phone to those self-isolating seniors that are at the highest risk. So these agencies not only provide food, which is of primary importance during this time, and household items such as toilet paper and toothbrushes, the household items that you regularly need. These calls help provide the calls made by staff, in addition to delivering these services telephonically, provide emotional support and general support. The agencies really are targeting and reaching isolated older adults that are fearful of picking up food or do not have the means to pick up food at various locations. We hope there's more collaboration with mental health providers and agencies providing home delivered meals, as these are the highest risk population. We're also very encouraged by a new all-plan letter issued by the California Department of Healthcare Services on April 15 to all Medi-Cal managed care agencies on efforts to prevent isolation and support older adults and other persons at risk, and continue to provide medical and mental health services, as well as make check-in calls with older adults that are at risk to check on not only their well-being, but also their health and overall mental health well-being. In addition, SCAN also provides 5 programs serving seniors and their caregivers in LA County and Orange County by providing emotional, social, and general support at no cost at the community at large, and we primarily focus on non-SCAN health plan members as we try to give back to the community. We've pivoted, like many others, to providing services over the phone and other telehealth platforms and tools. Just want to highlight a little bit about our Insights program, which is a behavioral health program implemented by SCAN Independence at Home. It is for seniors 55 years and older experiencing minor to moderate symptoms of depression and anxiety. We also provide services to the older adults caregivers, ages 18 plus. We understand that caregivers, especially unpaid family caregivers, are providing a tremendous support for these older adults. Nationally, there are about 34 million individuals that provide unpaid care for older adults. These are family members and friends, typically women, So due to the COVID crisis, you can imagine caregivers of older adults experiencing new challenges as they juggle their work schedules, their job security, caring for their own children as school closes, and their own food and home security. The emotional, physical, and financial impact of caregiving can lead to caregivers experiencing a heightened level of stress, depression, and anxiety, and other problems. So we really hope to, highlight this population as a vulnerable population. And the crisis really underscored the service, funding, and overall infrastructure gaps that exist around this growing older adult population and across the board pretty much. It is currently estimated that there are 8.1 million adults over age 60 in California, and this number is expected to grow exponentially by 2050 to 13.7 million. So I'll stop there for any questions, but we really want to highlight older adults as we begin to discuss population health, mental health efforts. Thank you.
Fantastic. Thank you so much, Mercedes. Appreciate that. And you are a wealth of information. So we're going to spend a few minutes now hearing questions from the audience. We do want to encourage you, if you haven't already, please be sure to insert your questions into the question box. And Mercedes, one of the things that I think would be helpful to expand a little bit upon is how philanthropy can be most supportive to that population in this moment.
No, great. That's a great question. Actually, philanthropy can do a tremendous amount of work and effort to really leverage the great work that community-based organizations are doing. Philanthropy traditionally, nationally, has been 1% to 2% of funding to really support older adults. So really raising awareness of this is and highlighting this population is sorely needed. I would really work with those agencies that serve older adults during this time, even a lot of senior centers and congregate meals and Meals on Wheels organizations that are providing a twofold sort of, helping individuals with nutrition needs, as well as really providing those check-in calls to really check with vulnerable older adults. So I would say those are organizations that really sorely need a lot of philanthropic support and attention.
Kirsty, the same for you. How can philanthropy be most supportive in what you're seeing on your end?
Well, I think philanthropy can be the most supportive by two things. Number one, funding that allows our infrastructure to really open up and provide the services on a wider scope. So I think that is, kind of an obvious one. If we've got, 300 providers that we want to, invite to share their services pro bono for people that don't have access to it. And then number two, I think it's just outreach and education and helping spread the word that, emotional wellness and coping skills are a priority right now. And we don't want the general population to forget that. I think that a lot of people, at least in the work that I've seen, they are very stressed. They are emotionally exhausted. And there are times when they don't even recognize that. They are so concerned about, food on the table, paying rent, and kind of those basic concrete supports. And worrying and stressing about that, takes a huge toll. And a lot of times that toll is paid by, you're shorter with your family interactions. You're not spending the time that you want to be spending, that quality time with your families. So I think reminding folks and really keeping that message of wellness is imperative. And I think, sharing resources on coping with COVID, how to stay socially connected even though we're isolated, how are we checking in with each other, how are we building community even though we can't go, see somebody at their house. So I think it's capacity building for infrastructure to open up the services that we want to provide, and then also helping to spread the word on, prioritizing wellness that will have an effect on every other aspect of people's lives.
Great, thank you so much. And Kirsty, another question popped in the chat box. It The comment was, it sounded like your effort was in Ventura County. Is there an effort to expand the network of pro bono therapists to support LA County residents?
Yes, there is absolutely an effort, and like I said, we have done that on the East Coast in New York, in New Jersey, and also Connecticut. What it takes is infrastructure support for our staff team to do that. So, our provider network manager, our recruitment team, myself, to do outreach and education with those folks. We're also educating all of our providers on, web-based platforms, which ones are the best to use, which ones are HIPAA compliant, and providing capacity building in that. So we would absolutely love to open up the network to additional populations. Our staff team right now is that, we're all at our max with pivoting to kind of meet this need and doing the psychoeducation. But that is something that we would love to do, and we would need, some seed money to build that capacity. But we have 300 providers, that we would love to reach out to and say, we're opening, who can serve. So, and it's not just LA. I would like to see it in all of Southern California, from, Kern County, Ventura County, all the way down to the border. So that is absolutely something that we've got our sights on.
Great, thank you so much. And Mercedes, when we start to think about long-term, thinking about the future, what is something you feel that funders should remember and know as we're moving into what Dr. Sharon mentioned as a recovery phase eventually, specifically for the aging and elderly populations? What should funders keep in mind about long-term needs that you're seeing?
I think, and that's a great question. I think this population will continue to be vulnerable and likely not be able to congregate or leave their homes for a longer period of time than the normal population, or just because their risk is so high. I think just supporting those organizations, and quite honestly, those organizations that are serving older adults right now are being bombarded and cannot handle the influx of delivering meals, groceries, and other providing those supports to older adults. So the infrastructure is really not there. So I really hope that funders can really work with organizations who have really stepped up and ramped up their capacity to continue to sustain that larger number of services over the long run, because it will be, a lot of them have been reactionary and have been great in these past couple of weeks, but we see this as a sort of more of a long-term infrastructure support that needs to be sorely funded.
Great, thank you. And this next question is for both Mercedes, you and Kirsty. Do either of you know of national or state level campaigns to support those in stress during this time and helping to do an outreach similar to the messaging on washing hands?
Yes. So Given Hour does have a national campaign called Change Direction, which focuses on recognizing the signs of emotional suffering and teaching the healthy habits of emotional well-being, as well as kind of trying to break down the stigma around mental health. And we have actually come out with very specific COVID outreach materials. One of them is on the slides that I shared. It was the last slide in that PowerPoint that talks about, coping with COVID. We also have a resource on dealing with grief through this, and also talking with your children about COVID and emotional wellness. So we do have those 3 resources, and those will continue to come out from Given Hour and the campaign to Change Direction. And people can find information on that at givenhour.org or changedirection.org. And all of those materials are free to download and share. And again, they're all Change Direction materials around emotional wellness, but they do have a COVID messaging to them around, staying healthy and healthy coping strategies through this time.
Mercedes, any comments or thoughts?
So the California governor did launch a campaign called Stay Home, Save Lives, Check-In. And it really called upon neighborliness to really check and call an older adult living in their life, to sort of check in, maintain social distancing, but remember to check in on your high-risk family and friends to really expand that network. So that has been, and I'd be happy to share that information in terms of just what you can do as an individual and what the state is doing and what different local entities are doing as well.
Fantastic. Well, thank you so much. My gratitude to you, Mercedes, to Kirsty, to Dr. Sharon for joining us today. I have learned personally a great deal, and that there's much to ponder and to think about and how we can continue to help you move this work forward. If you would all look into the chat box, my colleague Fong, our Director of Communications, has also placed some of the hyperlinks to those resources that were referenced during the conversation. We really appreciate you all. Unfortunately, that's all the time we have for now, but I do want to share really quickly a few updates from SCG before we close. This afternoon at 3 p.m., our partners at San Diego Grantmakers will be hosting a webinar with Dr. Peter Schultz, the CEO of Scripps Research Institute, to talk about the COVID-19 treatment and vaccine that they're working on. And you can find more information and sign up for that webinar through our website. We'll also hope that you'll join us on April 30th for the SCG Member Social Hour, our attempt to keep you all connected. That's going to happen on April 30th at 4:30. Please sign up through the SCG website. And then finally, we'll be hosting a mindfulness training, getting lots and lots of requests for mindfulness trainings during this period. This is going to be called Embodiment in Times of Deep Change, and this will occur on May 1st from 10 to 11:30. All of these details can be found through the SCG website. So with that, I want to thank each of our speakers again so much for both your time today and your work in response. I also want to thank the 100+ people who've joined us virtually to engage. We know at SCG that this is a critical time and that you have an avenue right now through which to connect and share learnings and resources and ask questions, and that's really what we want to offer to you. We're so honored to be able to support you in this way. So please, as I mentioned at the top of the call, take a moment to fill out our post-webinar survey, and you're always welcome to reach out to our team directly if you have specific needs or work that you want to make sure we are amplifying. Our next call will be on Thursday, April 30th from 9 to 10 a.m. We'll focus on public policy, so please be sure to join us. Register at SoCalGrantmakers.org, and until then, have a wonderful day and take care. Bye-bye now.
Thank you.
Thank you.